right, so welcome everybody to the HS Foundation's third annual patient-focused meeting, which is called Spotlight HS. We are so excited to have you joining us. This meeting originated to empower and validate people affected by HS in their treatment journey, and we're so pleased to be able to offer it for a third year in a row. Our hope in hosting this meeting is to provide best level evidence and answer your questions right here and now. My name is Jillian Andreka, and I'm an HS patient advocate, and I'm also a registered dietitian nutritionist, and I specialize in nutrition for HS. So I'll just kind of briefly go over some housekeeping tips. You can put your questions in the chat or the Q&A box, and we will do our best to get to all of them. And we do have committee members in the chat who can help answer questions. Please don't spam the chat, and please keep your questions broad, nothing specific to your cases or your loved one's case. And the recording will be available within the next 24 hours. All right, so we're going to kick off this session with Drs. Daveluy and Gretchen Roth, who will be busting HS myths. Dr. Daveluy is an associate professor and program director at the Wayne State University in Detroit, Michigan. He earned a bachelor's in science from Michigan State University and completed medical school and his dermatology residency at Wayne State University. Dr. Roth is an assistant professor and director of dermatology student education at the Medical College of Wisconsin in Milwaukee, Wisconsin. And after attending college at the University of Miami, she attended medical school at Vanderbilt University and completed her dermatology residency at the University of Iowa. She runs an HS specialty clinic at the Medical College of Wisconsin and has interest in HS, complex medical dermatology, medical education, and patient education. So we are so excited to hear your talk tonight, and over to Dr. Daveluy.
Thanks so much, Jillian. And we're so happy you could all join us tonight. And to the people who can't join us live, watching the recording, I really love the Spotlight HS event as a way to really share some great information to the people who need it the most. And I thought as we're kicking off the session with this myth-busting talk, this is the mythical beast, the Hydra from Greek mythology. So I thought Hydra, Hidradenitis, it's this multi-headed beast. And you can see these two brave warriors are fighting and fending it off. And I don't know about you, but to me, it kind of looks like one is attacking someone in the armpit and the other one is going for the groin. So kind of a lot of hidradenitis parallels with this mythical Hydra beast that we're going to bust today. So we're talking about myths. And the formula for a myth is a little bit of truth, and that's why it's believable. If something just comes out of left field and it doesn't make any sense, we just dismiss it. So the myths have to have a little bit of truth to them, and then they usually have an element of hope. And the hope is what makes us care about them. And it's also why we're impacted by these myths, is because we see a little hope. We hope that it's going to be useful for us or something new that's going to help us. And then we're disappointed when it turns out that it's not true. So with that, we'll move to our first myth.
Perfect. So we'll start with one that I think all of us have heard, and that's that HS only affects people who are, and you can insert whatever you want here. We've heard it all. So HS only affects women. HS only affects people who are obese or people who smoke or people who have poor hygiene. And it turns out there's a little bit of truth to some of these. HS is a little bit more common in women than men. You may be more likely to get it or have worse disease if you're obese or you smoke tobacco. And the other thing is that a lot of healthcare providers just don't have a great understanding of HS, which really makes some of these difficult. But we know that the reality is that HS can affect anybody. And we often don't have one particular trigger or one particular cause. And the shame and blame that comes from saying that HS only affects one certain group can be really harmful. Harmful for people that aren't in those groups because they feel like maybe they shouldn't have the disease for some reason. And it's harmful for the relationship that you're trying to form with the person who's supposed to be helping take care of you and help improve your disease.
Our next myth is probably something that you've heard before, is HS is an infection. There's a little truth to it in the sense that bacteria probably do play some kind of role in HS, and antibiotics can help. So that kind of seems like an infection, but the reality is it's not, because it's not contagious. You can't spread it. Other people cannot catch your HS. It also improves when we block the immune system. So calming the immune system down during an infection just makes the infection get out of control and get worse. But in HS, that can be helpful. And so we're trying to understand exactly what causes HS. And we know it's a combination of genetics, hormones, and the immune system all playing a role. And so we know that those bacteria somehow play a role, and that the areas of your skin affected by HS have different bacteria sort of living there than areas that don't have it, or even people who don't have it. But we think it might be more the way your immune system interacts with them that really triggers the inflammation in HS. So it's more of an inflammatory disease where your immune system is ramped up and overreacting. But HS is tricky because it looks like an infection. It's the same part of your immune system that would go to an infection and fight it by creating pus to kind of fight it off, and redness and swelling. So it really looks like an infection too, but it's not. You can't spread it. It's not contagious. And this is another one, like Dr. Roth just said, sometimes healthcare practitioners spread this misinformation and they call HS your infection. Your infection is spreading here and we need to change it here and treat it there.
So the next one is that it's your fault that you have HS, or that someone with HS, that somehow it's their fault. And really the main truth here is that probably you've been told that before. And because of a lot of the things that we talked about initially, where we sort of used to have a much more limited understanding on why people got this is something that a lot of people get told. But in reality, it's really, really complex, and not very much of it has to do with anything that you're personally doing. So we know that HS, like Dr. Daveluy just said, is some sort of overreaction of your immune system to plugged hair follicles and different triggers. And there's a lot of different things that come into it. Genetics, a lot of people with HS have some family members that are involved. Hormones can play a role, and we know that there's a major role that the immune system is playing. And part of what we're doing here today, and part of what we try to do all the time in our daily lives, is to educate everybody, including other doctors, nurse practitioners, PAs, other specialties, and the public about what HS really is.
Another one that sort of correlates with some of the other ones we've talked about is HS is a sweat gland disease. The truth here is that there are these things called apocrine glands, and there are sweat glands that sort of develop. There are oil/sweat glands that develop when we hit puberty. So the parts of our body that kind of get oily and get body odor show up during puberty. So they're in our armpit, they're in our groin, they're on our chest, they're in our scalp. And HS tends to show up in the areas that we have these apocrine glands. So that's why early on, scientists and doctors kind of thought, oh, this must be those glands, the problem with those glands, because it's in those areas. But the reality is it involves other areas too, where you don't have these glands. In fact, HS can pretty much go anywhere on your body you have hair follicles, so not the palms and soles, but pretty much anywhere else. We also know that it's more related to the hair follicle than these apocrine sweat glands, because laser hair removal can help. So getting rid of the hairs in the area can help. And those sweat glands are still there when you get rid of the hairs. And then again, we kind of keep harping on this point that there's genetics, hormones, and the immune system playing a role, but it's not just a sweat gland disease. And this is one where you will likely even hear some old school providers say things like, oh, they just need to cut out your sweat glands, or even some surgeons say, I'm going to remove your sweat glands. They aren't. They're just removing your skin. They're going to take off the full thickness area of the skin in that area, so your hair follicles go with it, and your HS can improve with surgery that kind of removes the area affected by HS. But it's not a sweat gland disease. But as Dr. Roth just mentioned, sometimes we need to educate our fellow physicians and healthcare providers about this, because this is kind of an old thing that still gets said in the healthcare setting that really isn't true.
So the next one is that there's no treatment for HS. And sometimes people are told to just leave it alone, ignore it, and when it gets bad enough, you can have it cut out. And there's a little bit of truth to that. Before 2015, there weren't any officially approved treatments by the FDA. And it's still true in a way that there isn't sort of one treatment that fixes everyone. And there's no cure that we have yet. And it is a really hard to treat disease. But the reality is that there's actually a lot of options to treat. So there's actually now 2 approved medications. We forgot to update this.
Yeah.
2 FDA approved medications, but there's a lot of things that can be used that aren't necessarily approved by the FDA for HS. That basically just means that a lot of specific trials have been done and the FDA decides that that specific medication is good for this particular thing. There's actually at least 30 different medications that we talk about in our HS guidelines that can be used, multiple different procedures, surgeries, lasers, and the really exciting thing is there's so much research going on right now to find new ways to treat this condition, new combinations of treatments, and it's a really, really exciting time to sort of see what's coming down the pipeline.
So don't lose hope. Things are looking better and better every day. Another myth that you hear sometimes is really a well-intentioned myth. It's, oh, this worked for me, it will work for you. You know, I went on this diet, my HS cleared up. If you go on this diet, your HS will clear up. And the truth in there is that it did work for that person. And maybe it even worked for other people, and that's how they heard about it, or other people are kind of chiming in, oh, that helped me too. The reality, though, is everyone is different. Sometimes something that works for one person works for another. Sometimes it does nothing. Some people, cutting out dairy makes a huge difference. Sometimes it has nothing to do with it. Sometimes avoiding this in your diet or changing this makes a difference. Other people, nothing at all. And the reality is people have good intentions. They found something that works for them. They want to help other people, so they spread it. But the impact is that disappointment comes. So it's a lot better. And this is something that you can make sure you're not sort of participating in this myth, is if something works for you, it's okay to share it online and let people know, but do it in a way that makes them not get too much hope that it's going to guarantee and work for them. Say, this worked for me, I hope it will work for you. I've heard it's worked for other people. It's worth a try. But you don't want to make promises that you can't keep. You don't want to tell somebody this is the absolute cure for HS and I found it and this is it, because everybody's different. And we know that there's a lot of different sort of subtypes that we're figuring out with HS and trying to figure out what works better for one or for another, but we're not quite there yet. Maybe someday we'll be able to say, this is going to work exactly right for you. And I hope we get there. But for now, it's really important that you spread things that do help you, but don't overpromise that it's going to help for everybody who reads it, because then they're just going to get discouraged and disappointed and might even feel hopeless.
Can I add a quick comment to that, Dr. Daveluy?
Absolutely.
I think the opposite is true too. I find a lot of patients who come in feeling really, really fearful of one particular medicine or one particular surgery because they know someone who's had a bad outcome. It's also really important to know that the opposite is true. So sometimes someone does, medications do have side effects. Sometimes people have surgery and their disease recurs, but just because it happened to one person doesn't mean it'll happen to you. So these are really important conversations to have with the person who's helping take care of your HS.
That is an excellent point, because I've had quite a few conversations with people who are sort of scared out of trying a new treatment because of what they've heard from people online. And we sort of spend a lot of time talking about how, well, that, is either a really rare side effect, or I can't even confirm if that was the side effect of the medication, or like you said, if it was just, it's hard to make judgments. So that's a really, really good point. Thank you for adding that in, Dr. Roth.
Mm-hmm. So that brings us to the next one, which is, if I find the right diet, I can cure my HS. And I wish this were true. I really do. But as of now, it's not. So a little bit of truth to this. We do know that diet can have a really big role in inflammation and in the immune system. We know that certain foods, including things like dairy or brewer's yeast, can trigger flares for some people. But this is a really hard one because it's really hard to study diet. And this is another one where the same thing doesn't seem to help everybody. So in reality, possibly can help. Rarely do we find people who are cured by a change in diet. And other people who end up really disappointed because they make all of these changes and then they have no change in their HS whatsoever. So definitely worth looking into, but important to go into it, knowing that it may not be the end all be all. And also really important to do this along with someone who can help guide you so that you're not sort of cutting out a lot of things that you need to stay healthy. And Jillian probably could speak to that. Maybe we can talk about that in the chat or in the Q&A at the end, but.
I was thinking the same thing. I'm like, oh,
Yeah.
Jillian can tell you all about diet and how complicated dietary triggers can be in HS and how complicated it is to study that too. Yeah, and that's exactly right. I tell people, you know what, if you're going to make some changes to your diet and they're healthy things anyway, great. Even if it doesn't help your HS, you're still living a healthier lifestyle. But hope that it's going to help it. And if it doesn't, say, okay, well, fine, I'm still just having a healthier lifestyle and eating better foods and avoiding things that I know are just kind of bad foods anyway. So the next myth is there's one perfect treatment for me. I just haven't found it yet, which is sort of the Cinderella story. The truth is this could be right. Sometimes there is that one perfect treatment that really works well. And it does work for some people. They go like, oh my gosh, I found this treatment and boom, it just worked like a charm. The reality is that for most people who have more than mild disease, they need a combination of treatments. When we do our clinical trials right now for HS, we call the treatment successful if you get a 50% improvement. In my clinic, I'm not happy with a 50% improvement, and my patients aren't happy with a 50% improvement. And it's at least a 50%, I should say that. So it's like I said, some people do way better. They get like totally clear on the treatment. But if you get at least 50% better, it's considered a success. But I don't stop there. So if you get 50% better, we're going to add on another treatment and hope it gets us another 40% better. And then one more to get that 10% gone. And this is where, again, we're talking where hope can kind of help or hurt. You don't want to give up on a treatment because you're looking for that one treatment that's going to get you totally under control all by itself. And you don't want to pass up the option to combine a couple treatments to get you to where you really are living your best life and having the best control over your HS. So that's a really important part of it. You don't want to be Cinderella waiting for the prince to come and pass up on all kinds of great friends. So it's all about setting those expectations that, this treatment may not get you all the way there, but by combining things and getting just the right mix, we're going to get you under control. Then the other cool thing with this is there are new treatments coming. So we're really, with some of the new research, pushing that envelope, and we're going to start looking at a 75% improvement as being the standard for what's considered successful. And we saw this happen in other disease states too, like for us, psoriasis. 50% improvement used to be good. Now we went for 75. Now we go for 90. So we'll get there as we keep advancing the field and coming out with new treatments and new ways to combine treatments, and even combining medicines with surgery is sometimes important, where your medication takes you so far, but you still got that one spot that gives you trouble all the time, or that one tunnel that keeps draining, and you do a little surgery on it. And we're actually doing some research to show that that's beneficial to combine the medications with the surgical procedures as well.
And that actually brings us to the next point, is that surgery is the only treatment. And hopefully we've dispelled this one already, but there's definite truth to that. Surgery can be a treatment, but it's important to remember that surgeons are trained to do surgery and they can't necessarily help with the other aspects of the disease. So surgery is 100% one of the tools that we use, but it's just one of the tools that we use. And it's often best done in combination with medical treatment. Like Dr. Daveluy said, a lot of times we're using medications to calm things down and then using surgery either to treat the scarring left behind or the active spots left behind. And doing it this way sometimes means you can avoid a lot of surgery that you may have thought you needed. And hopefully the medications also help prevent you from getting new spots at the edges. So if someone's telling you that surgery is the only option, definitely important to talk to somebody else.
And then one of our other myths is no one understands my HS struggle. The truth to this is many people do suffer with their HS and not know anyone else has it. You do feel very alone. It's a hidden disease. Very few people know what it is or can even pronounce the name of it. So you probably go to a few doctors, no one knows what you have. And when you can't even put a name to your disease, you really feel alone. Like literally no one you've ever met knows what it is. And a lot of people, like I said, haven't ever met someone else with HS. So it can be very isolating and make you feel very alone. But the reality is you're not alone. We always say it is not a rare, I should quote Brindley Brooks from HS Connect. HS is not a rare disease. It's just rarely talked about. And that is absolutely true. It is much more common than we used to think. We think it's somewhere between 1% to 4% of the population may have HS. So you're not alone. And the best way to fight this myth is to connect with other people who are affected by HS. So patient support groups are phenomenal. They really have the best impact on your quality of life, because while we're struggling to get your HS under control, you may have some flares, you may have some setbacks, but if you have people you can talk to and relate to and can support you during that, it makes a huge difference. So I really recommend all my patients get involved with HS support groups, connect with other HS patients, and it really kind of normalizes it for you and makes you feel like you're not the only person going through this. Other people actually understand what it's like to live with HS, what it's like to go to a job interview and be scared that your boil is going to rupture, what it's like to wear clothing that hides your HS or hides your bandages, what it's like to worry that someone's going to smell while you're discharged. People you can relate to, and then they can share amazing tips about living with HS. So much more than what your doctors and healthcare providers can share with you about little tips like HS emergency kits and what to pack for the airport or a plane, all kinds of things that I can't even speak to.
Amazing. So we wanted to leave a lot of time for questions. Those are our main HS myths, and we want to hear from you. Any myths that you've heard or want dispelled, and I think we can go through questions now.
Great. Thank you both. That was awesome. We do have some questions. So we'll just jump right in. The first one is, what is the best way to figure out food triggers? And I can help answer it if you like.
Right? Jillian has a
Why don't
very
you
good
just
way.
take it away?
Yes.
Okay. So I would suggest doing some journaling around like your flares and different activities that they mentioned in this talk. So maybe stress, hormones, exercise, what you're eating. Journaling is a really good way to figure out what's going on for you specifically. And I do have some free webinars that maybe we can link in the, I guess we don't have show notes. Maybe we can attach that somehow so I can get you that information. And move on to the next question. Can you share more details on hormones, like which ones, and what have you heard from patients?
Sure thing. So we know that hormones can play a role in HS. Some of our big clues to that is that in our female patients, they'll often experience flare-ups right before their menstrual cycle. And that's when your estrogen is sort of lower and your other hormones like progestin kind of goes up. So we know certain hormones can affect the disease. And we also know that some of our therapies can be helpful. So like certain forms of birth control that contain estrogen have been shown to be helpful in HS. There's also a medication called spironolactone that it doesn't change your hormones, but it blocks the receptors so that they can't affect you as much and can't affect your skin. That can be helpful. There's another one called finasteride that's been studied that sort of blocks the conversion of hormones into their active form. And even metformin, which is sort of a diabetes pill, but it can help on the hormonal side. The other thing to remember is that for some people, some forms of birth control can make HS worse. So the ones that are progestin only, so like the typical is the Depo-Provera shot. I've had a few patients who flared up when they get that because that's the hormone that seems to be more of a trigger. Again, it's one of those situations where it's a little different for everybody. So definitely if people are experiencing premenstrual flares, we talk about some of the hormonal therapies, but even people who aren't, it can still be effective. So it's one of those things where it could play a role. Typically, your hormones are not abnormal when they do the test. Like if they order your blood work to see, your hormones will still all be in the normal range. It's just that it's not normal for you, or it's still affecting your HS, which is something we see even with acne, with like hormonal acne, is that your hormone levels are still going to be normal, but it just doesn't mean that they're affecting you in the way they are affecting you in a way that still can trigger your HS.
That was great. I got nothing to add.
And I did just get a message that we have a app for HS. Sorry, I forgot to mention that. It's from Papaya, and you can do tracking in there as well. So that's a great resource. More questions are flying in. The next one is, can a flare happen inside your stomach, intestines, etc.? So maybe just inside.
That's a really good question. I'm trying to think how to answer that. Not HS specifically. HS really is a disease that affects the skin. But HS is sort of associated with a lot of inflammation. And sometimes when we have flares of inflammation, it can affect other organs. Also important to know, though, that people with HS are more likely to have certain other autoimmune conditions, and some of those do affect the gut. So if someone's having sort of abnormal gut symptoms like belly pain or bloody stools, lots of diarrhea, that's actually important to get checked out to make sure that there aren't other issues going on that are maybe just more likely when you have HS.
Yes, and also to add on to that, there's one called Crohn's disease,
Huh.
and Crohn's disease can actually show up in your skin and look a lot like HS. So make sure you bring that up if you're having those intestinal symptoms, because you could, and Crohn's disease is more likely in people who have HS. So you could have both, or it could actually be Crohn's disease affecting your skin, in which case they might go for some of the treatments that help both diseases.
It's very true.
Thank you. And how can you find your HS type or subcategory?
That's a good question. We are still sort of figuring out the HS types. And there's been, because sometimes early on in research, it's kind of different people have different ideas. So there's been a few different articles and research studies that say, okay, this type is more common in women who are overweight, and it's under the breasts, in the armpits, and in the groin. This type is more common in male patients who are thinner, and it's more widespread. This type is more associated with hormones. So we're still sort of figuring it out, which unfortunately sort of means that we don't know yet how to use that to tailor your treatment. So a lot of the treatment is still really based on how you respond to different treatments. So we sort of take a look and use the stuff that tends to work the best, see how it worked, and then see if we need to tweak things and adjust things. But I hope someday we'll get to the point where we can say, okay, we know you have this subtype and this medicine works great for it, but we're not quite there yet. Someday.
The next question is, how can I control flares after sweating in affected areas? I've stopped exercising because even if I shower or clean the areas immediately, I still get horrible flare-ups. And I'll just personally add, I totally can relate to that. Exercise is just one of those triggers that's hard to modify. So excited to hear your answers on this.
Oh man, it is a hard one, and exercise is obviously important as part of living a healthy lifestyle. And that's something in a really broad sense, I think maybe worth bringing up with the person who's helping care for your HS, because I sort of use a lot of different strategies with my patients. One is if sweating is a major concern, sometimes addressing that either with topical antiperspirants or even pills that reduce sweating. Sometimes that can help. It may be a matter of finding sort of a better bandage or dressing that helps prevent friction. That's hard. Dr. Daveluy, you got others?
No, I think that's a really good point you brought up about the treating the sweating. So there's even been some studies of the pills that help to reduce the amount people sweat, that we call that hyperhidrosis, excessive sweating. But some people with HS who didn't really say they had excessive sweating still reported improvement with the treatments to reduce sweating. So that can be kind of a good one if you really notice sweating is a trigger. And then sometimes you can try to go for exercises that induce a little less sweating. So like for some people, longer walks or lower impact exercises. For some people, swimming is a good option because your body kind of stays cooler in the water, or yoga, just not hot yoga because the sweating part of the hot yoga. And then trying out different sort of clothing too, because they have the clothing that can sort of wick the moisture away a little bit. So sometimes that's helpful to kind of keep areas drier, but it's a challenge. I know some of our colleagues are trying to study with personal trainers and physiologists to say like, okay, can we put together an HS exercise packet that's not going to cause flares from sweating and friction, but is still going to allow people to get healthy exercise? And it is a challenge.
I love that.
Ooh, we'll have to
And
stay tuned for that.
yes, and the HS Foundation is actually funding a study on exercise in HS. So stay tuned.
That is great. Yeah, I struggle with that myself. Walking can sometimes make it worse, or like things like biking. So excited to see what you guys come up with. Weightlifting too might be a good one where you're not like sweating a lot. Next question is, does the sun trigger HS? I have HS on my face, and I do think it's worse in the summer months.
That's
So
a
the
really good
sun
question.
isn't a usual trigger, but maybe it's the sweating. Also a good thing to bring up with your dermatologist or your provider to kind of talk, because HS can happen on the face, but it can sometimes overlap with other conditions. So just make sure you kind of bring it up with them. And you could always try, you know, being really vigilant with sunscreen, shade, hats, and see if that makes a difference. Because I always tell people, if you aren't sure if it's the sun or the sweat, take the sun out of the equation and see what happens. And if you're still flaring out in the heat when you're in the shade or carrying an umbrella or wearing enough sunscreen, then you know it's not the sun, it's the heat.
There is a question about smoking marijuana and affecting HS, and I do just want to point out that we have a session on cannabis and HS April 17th at 7:30 p.m. Eastern time, and it is recorded. So I think maybe we can just have that question be for that session. Next question is, what have you heard about leveraging zinc, vitamin D3, along with improving diet?
Yeah, I think that is one that sort of goes along with some of the myths we talked about earlier and diet in general, which is those are all things that in certain people, especially in combination with other treatments, can be really helpful. I have not had many patients who do like one of those and just suddenly get better, but I think they're great options. And I don't know if you have additions to that, Jillian, at all.
Yes, there are a handful of studies for zinc and HS, and basically for both of them, patients in the studies who were deficient that had appropriate supplementation, their HS improved. So definitely something to look at, see if you're deficient.
Mm-hmm.
And can you speak to the role of stress?
How much time do you have? No. So we know stress is a huge factor in HS. We know that the HS causes stress, obviously, and increases your odds of having depression, anxiety, mental health struggles, reduced quality of life. We also know that stress can then release stress hormones in your body that can trigger more inflammation. So sometimes it becomes this vicious cycle of your HS stresses you out, your stress makes your HS worse. So it's really good to talk to your doctor or your healthcare provider about the stress it's causing you and how it's impacting you. Sometimes it's good to talk to a mental health professional, because even though they may not be able to directly address your HS, they can help you to cope with the stress a little bit better and break that cycle. So that way the stress of having HS doesn't affect you as much. And it's like I said, I always tell my patients when we talk about the role of stress and we talk about things like relaxation techniques, breathing techniques, I say, I'm not giving up on treating your HS. I still want to get it under control. But in the meantime, I also want you to be free of the impact that the stress is going to have. So it's a good thing to talk about. And I think we're getting better, but we still don't talk about mental health enough.
Yeah, that's so important. There's such a stigma that we internalize from society, and it makes it hard to sort of make that distinction. So I loved the way that you described that.
Is there a link between HS and improved or regular bowel movements?
You know, that's a great question. I have not seen, there's been some studies on the microbiome of the gut in HS. I haven't seen specific studies about sort of regular bowel movements, but I do know that generally high fiber diets are good for you. They really help your immune system, and some medications actually work better the more fiber you have in your diet. And fiber feeds those healthy gut bacteria. So does having a variety of plants in your diet. So meat is okay, but your gut microbiome really loves plants and all that fiber from the plants. So if you can eat a variety of plants every week, that has been linked to better health overall. Just when they did this big microbiome study, and people who had more diversity in terms of eating different plants, and the magic number is 30 plants a week, which sounds impossible until you think spices, fruits, seeds, nuts count. So eat a salad and throw some pumpkin seeds and some chia seeds in there. But having that diversity in your gut has been shown to be helpful in general. Not super well studied in HS, but there are microbiome studies going on in HS to see what is that gut-skin connection, because we do know that our gut really heavily influences our immune system.
Very exciting times.
So you should have at least one bowel movement a day.
I loved your answer. Next question is, why are statistics higher in African Americans?
That's a really good question, and I don't think we have the full answer to it yet, but probably a couple of different things. One is there's some question and some I guess some questioning about whether the different hair follicle biology, so having more curved follicles, makes you more likely to have plugging of follicles, which is one of the major sort of triggers and drivers of HS. But also tons of research going on in HS and others about the impact of just sort of systemic racism and things like that that lead to just differences in how certain patients get cared for than others, and the general stress that you have to deal with in life. So a lot of different things that probably go into that, and it can be really hard to tease those out.
The next question is there any HS specialist advocating for insurance to pay for bandages, and specifically bandages used for HS? And also, what about clothing?
Yes, there absolutely are. So we are working hard to try to get coverage and try to make insurances understand. Couple little life hacks. If your insurance doesn't cover enough bandages now, if you buy them on Amazon, and I don't get any money from them, but it's much cheaper. You can get very affordable gauze and bandages there, just because it's sort of a discount compared to going to your local pharmacy and buying them. And then there is a lovely HS patient who has designed clothing to hold bandages called HydraWear. And again, no conflicts. I don't get any money from them, but I tell my patients about it all the time because it can be a really nice way to it's clothing that has these mesh, and you can kind of clip the bandages in to catch drainage. But that is a big problem. And sometimes that clothing is covered by insurance. So if you're interested in it and you talk to your doctor, the company can actually provide them with some forms to submit to your insurance to try to get those covered. But we try to get bandages covered. It's a big issue, all the extra bits that go into caring for some diseases that the insurance doesn't cover. Sometimes too, you can use, if you have your healthcare savings account, that's your you don't pay taxes on that, you can use that to purchase bandages. And there's even online stores where you can use those savings accounts to make purchases and get all kinds of things, from bandages to sunscreen to toothpaste.
Yeah, those are great tips. This is one where we try and fight, and this is a struggle for a lot of other conditions too. The insurance coverage for wound care supplies is just not good. Not as good as it needs to be.
So for HydraWear, I think you mentioned this, Dr. Daveluy. I know that they have insurances in various countries that they're working with, kind of newly in the US, because I've gotten some myself through insurance, and the FSA, HSA cards. And I also wanted to point out, if you're interested in that, we have a wound care session. It's Friday, April 12th at 12 p.m. Eastern time. And I'm sure they'll be talking all about wound care and those bandages. So next question we have is, what have you learned or seen in your patients taking Otezla? It's not FDA approved yet, but I'm curious how others are doing with this medication.
I don't
So
have tons of personal experience, so if you have any,
no,
Dave
I
Louie.
haven't really personally used it. I have seen some small studies where basically people have tried it out and they've reported some benefits. Having said that, you always have to be careful with those small, they're called like a case series where they say, hey, I used it in this many patients and it worked, because it's not like a real structured study. So sometimes they do one of those and go, oh, this looks like it might work. And then you do the real study and you go, oh, it didn't really work. Probably it was just kind of luck that those people got better, or maybe they had other people they tried it in that didn't get better. But it has been studied a little bit. Having said that, there are a lot of medications that are being studied right now. We just had our second FDA approval, and there's another one that already has everything ready to submit for approval. So it should be approved by the end of the year, and a lot more that are being studied, and some that block the same part of the immune system that Otezla blocks. Maybe a little differently. So there's more to come on those, and we'll see. And there should be a lot more treatments coming out that's really going to be great for when that way, if you get stuck and one doesn't work great for you, there's options.
That's exciting. Is it true that lancing and packing a painful large abscess isn't as beneficial as just leaving it alone?
Yeah, that's a really good question. I think we sort of waffle both ways on this. So the main reason that a lot of times dermatologists try to talk you out of having boils lanced, or HS abscesses lanced, is that they come back almost all of the time. And the packing doesn't really seem to prevent them from coming back. And it's really uncomfortable for people to do every day. The times that I think about doing it are when it's, big and looks like it's about to burst and the patient's in a ton of pain. And sometimes it can be good just to give you some short-term pain relief, but just really important to know that sometimes you're going through a lot of trauma actually getting it drained, and it may not give you the best long-term outcome.
Yeah, and to piggyback on that one, the lancing, it tends to come back a lot, but we have this other procedure called de-roofing. It's almost the same, but instead of just draining it, they take the roof off and let it heal in from the bottom, and then it usually doesn't come back. So shameless self-plug, if you put in my last name, Daveluy, plus de-roofing in YouTube, there's a video. So if you're at the ER and they don't know what de-roofing is, or your doctor, it's a little video that's less than 5 minutes to show them that they can do de-roofing. Give it a try, do this for me, and there's a much better chance that that spot won't come back. And then, like Gretchen said, the packing really doesn't add anything, and it's a nightmare to take out. So we tell everybody, don't pack them, just leave it to heal in from the bottom.
Such a good video. I've used it many, many times.
Yes, yay, de-roofing. So next one is about menopause and hormones. Can HS get better or worse during menopause?
Sometimes it gets better for people, but it's not super reliable. So it can persist beyond menopause. It can even show up during or after menopause. But some people, it does get a little bit better as those hormones go down. At the same time, there's a general trend that for a lot of people, HS kind of improves as you get into your senior years, and all of our hormones calm down a little bit. So it may just be that effect, but it's not true for everybody. Unfortunately, HS can show up later in life and it can persist later in life. So don't count on that happening. Keep up your care with your healthcare provider and hope that it will go away.
Can HS become cancerous?
That's kind of a complicated one. It doesn't lead directly to cancer, and obviously the vast majority of people with HS are not going to get cancer within it. But we do know as dermatologists that a lot of skin inflammation that lasts for years and years sometimes can increase your risk of getting skin cancer in the area. So that's actually one of my plugs for trying to treat your HS and calm down inflammation. It's super rare. I don't want people to think that this is a common way that it goes, but it's just something to think about.
Next question is, I've encountered patients and healthcare providers referring to HS as boils. Do you both have any suggestions regarding how to debunk classifying HS as boils?
I feel like
That's one that
used the word boil.
I've kind of learned to let it go with boil, because I think in a way boil does kind of describe an abscess. Maybe it's like the traditional term for an abscess. And the one advantage of sort of embracing the word boil, it's not great, but it's easier to learn. It's more of like just a regular person term than saying abscess, nodule, tunnel. And the nice thing is that using the word boil can sometimes help people to realize that they may have HS. So if I say to someone with, sometimes like a patient comes in with severe acne and they're only showing me their face and their chest, and I say, do you ever get boils in your armpit or groin? They know what that means. Or if they don't know what that means, they may ask me. So I'm not a huge proponent of like not using the word boils, because I more so just want to meet people where they are. And if you call them boils, that's fine. If people in your family call them boils, good. Ask them if they get boils and tell them to come see me.
I love that, but important, and I think your question gets at this, that boil is not the diagnosis. I mean, if you have recurrent boils in these areas over time, you probably have HS, so.
Yeah, I think boil might be more of the term like you hear of, and then when you get into the diagnosis, you can change the terminology. There's like some education that goes there. Yeah, we've been talking about that in the patient groups too. Next question, in relation to hormones and HS, what have you seen in patients when they become pregnant? As a young woman, it's something I worry about my HS getting worse and being unable to use certain treatments during pregnancy.
That's such a good question, and we're really lucky that there are people doing a ton of research on HS during pregnancy and HS treatments during pregnancy. So we do know that, like many skin conditions, sometimes HS flares during pregnancy, but sometimes it calms down. And one really exciting thing is that even though some of these treatments that we use are newer for HS, like adalimumab, secukinumab, things like that, we have lots of understanding of these medications in other skin diseases. And I hope a lot of dermatologists are comfortable using a lot of treatments throughout pregnancy. Because as a pregnant woman, you are still a patient, and it's still important for your disease to be well controlled. When I treat pregnant women, a lot of times it's a matter of sort of working with their OB, who may not be quite as comfortable using some of these medications, but there's a lot of other conditions we use similar medications for. And so I find more and more they're also comfortable treating patients during pregnancy.
And we are running up on time a little bit, so maybe just a couple more. The next question is directed to me, and if I've tried cold compresses after exercise. I have not, but I will. Thank you. And then maybe the last question for tonight, does a patient's Hurley stage play a role in the treatment plan that you recommend for them?
So it can. So the Hurley stage was originally developed to tell if you needed surgery or not. So Hurley stage 1 is you just get spots that come and go, but they don't leave much scarring. You don't have any tunnels. Hurley stage 2, you're starting to get scars and tunnels forming, but you still have some normal skin in between the spots. And Hurley stage 3 is when it's sort of taken over a whole area. So your whole armpit is full of HS with scars and tunnels and spots. And so in that sense, we look and we say, okay, if you're Hurley stage 3, you're almost certainly going to need surgery. If you're Hurley stage 1, you may not need surgery, and the medications may be enough to get it under control. And if you're Hurley stage 2, you're probably going to need a combination of medications and maybe some surgeries for the spots that don't clear up with the medications. So it does play a role in the sense of that like surgical assessment. A lot of times you'll see, and we even do this in the guidelines because it's convenient, is to sort of use Hurley stage as mild, moderate, severe. So sometimes you'll see that too, and it just kind of drives people to be a little more aggressive with treatment or try a little harder to get it under control if we start to see you progressing, because we're afraid we don't want that permanent damage to happen, those tunnels and scarring. So if you're kind of moving from Hurley stage 1 to 2, time to step treatments up and really get it under better control.
Okay. So thank you, everybody. I think that's almost all the time we have for this evening. Thank you for joining us. So we did get to almost all the questions. There's just a few left. And the next session will be on wound care on Friday, April 12th at noon Eastern. So we hope to see you there. Have a great night.